okay? ABCs, and then everything's kind of the same, and we're delegating, just like we were on the last one, and then at the end, let's, make sure we make that, the sick, not sick, BLS or ALS, and your transport decision, okay?
So, Jenna. What's the?
Wait, that's yours for now.
Cheers.
Two, yeah.
Oh, okay, okay.
I have my second vaccine, it's okay.
Okay, alright,
Alright, BSI. Scene is safe.
the scene is safe.
Scene is safe.
What do you have?
One supine female, skin looks dry.
Yes, you have one patient, she's at her home, she's sitting out in the back part of her house, there's a ladder, and there's a big garden, and some lights stringing from the gutters, and she's laying on the ground, she's looking around and
Okay.
wiggling her arms.
Alright. Alright. Hi, I'm Dane. Fire department, how you doing? Good, okay. What's your name?
Caitlin.
Caitlin? Alright. Can you take this back for me? Caitlin, what happened today?
I fell off my ladder hanging lights.
You fell off your ladder, hanging lights. Okay. You got a good pulse. I'm just gonna check for some bleeding, okay? Do you know what day it is?
Saturday?
Saturday? It is Saturday. That's good. No blood. No blood. I'm gonna lift your shirt up, okay?
And remember, just ABCs. You said good
Oh.
pulse, but let's just make sure we say it.
Okay.
ABCs are intact.
Yeah, ABCs are intact. So we're checking for blood. No blood. No blood. No blood. Where does it hurt?
My back.
Your back hurts?
Yeah.
Is that lower back?
Yeah, I fell off my ladder, so.
No blood? No blood? No blood? No blood. Okay, does it hurt anywhere else?
Not really.
Do you know where you're at right now?
My home?
Your home in Kent at the training consortium?
Yeah.
Alright. You wanna size up a C collar for me? Okay. I'm gonna just feel around and make sure you don't have any other injuries, okay, besides your back. Alright. No crepitus, no soft spots. You feel anything under your hands there? Okay, I'm gonna check the spine, C7. Alright, no step offs. Mandible is intact. No tracheal deviation. No JVD. Okay. Clavicles. Does any of that hurt? No? Okay. Can you take a breath in for me? Okay.
Oh, she says that hurts, and it feels hard to take a deep breath.
It's hard to take a deep breath. Okay. We'll keep going here. Because you appear to have a good airway to me still. Alright. Check your hips.
What might you, so, sorry, Dave, what might you wanna do at this point? If somebody's complaining about their breathing?
Well, so I was on the ribs, and I'm gonna take a good look there and see if there's a broken ribs, discoloration,
Okay,
crepitus, whatever. I might wanna get somebody to do, she has an airway, but I might see if she's perfusing, so get a O2 sound or something.
okay, what's the easiest thing to do right in this moment as you're marching down and she says, oh, I'm short of breath and it hurts to take a deep breath?
Would it help if we change her position?
How about just breath sounds real quick?
Oh, just take a listen?
And how about, yeah, so we can do, we talked about it real quick,
Yeah,
just on,
yeah.
right, so, okay, so that's just real easy, it's really fast.
Sure.
So listen, make sure she has breath sounds present, and then if somebody says they're short of breath in a traumatic, situation, we wanna get those quick breath sounds, and you could also throw her on O2.
Oh, okay, alright. Yeah, so let's go ahead and take a listen again.
But you were right in your assessment that she is talking to you, so she has an intact airway, but she does have a breathing complaint.
Sure.
Okay?
We'll go ahead and take a listen to your lungs here since that hurt a little bit. You had a little difficulty breathing, okay?
For O2, would you use a non-rebreather mask or like a nasal cannula?
I probably.
I'm
Yeah, I
gonna
was gonna say non-rebreather, but.
Yes,
I don't know.
so I know that may seem a little extreme, but in a traumatic situation and the way we're learning, we're putting on, you'll learn more and we'll get further into it, but for this scenario in a trauma situation with a breathing complaint, non-rebreather.
Okay.
Okay.
Tyler, you wanna
Sorry.
set up O2 for me?
Yes.
Alright, I'm gonna go ahead and lift your shirt here. Can you breathe in for me? To be honest with you, I don't hear anything with this stethoscope.
Somebody else said that.
Yeah,
had
it's
trouble with it. Yeah.
I didn't grab mine.
Is it you?
Oh, it's in that little pouch right there.
This one?
No, this one.
You want me to actually get this out?
Yeah, so, if you're gonna administer oxygen, just tell him what you want him to do, the rate, how, and you don't actually have to put it on her, but.
Yeah. So get us set up, so everybody says 15 liters per minute and then the sheet says adjusted 10, so which is it?
Yeah, so you could do 10.
Okay.
Yeah.
Yeah.
Okay.
Get us set up with the non-rebreather, fill the bag and then
So.
adjust it to 10.
Yep.
It's like, there's a very small one, like that big, and then the bag belt is bigger, like you do for the-
Right, but the non-rebreather.
Alright.
Yeah, the big thing that you need to, it has to be at least 10, and you need to fill that reservoir up.
Can you breathe in for me?
15, just
Yeah, breathe out.
And you'll be fine if you
And
say
I hear that
15.
much better. This side? Breathe in for me? Breathe out. Are you just doing the bottom ones, or are you doing all four?
Just the sides, on this, because it's just a quick one, for this rapid trauma,
Sure.
we're just doing boom, boom. Does she have breath sounds present?
Okay,
Putting your
oxygen. okay, we're gonna go ahead and give you a little bit of oxygen, maybe it'll help you breathe a little better, but your breath sounds are good for now, okay?
Holding at 10. So.
Pick up where we left off, any pain there? Okay, in, down, nothing. Right, can you feel this?
Yes.
You can? Can you wiggle your toes for me? All right. Got one. Got the other one. Can you feel that? Wiggle your fingers for me. Okay, we're clear. Go ahead and put the C-spine on for me, or C-collar on for me. All right. So, Tyler, can you start doing blood pressure and depth of violence for me?
I'm not great at that. I need more practice with that.
Perfect. Then now is the time.
Alright.
Go ahead.
Let's practice.
I definitely couldn't hear anything with that stethoscope though.
Okay.
All right. Caitlin,
Yeah.
aside from your back pain and a little bit of difficulty breathing, do you have any other pain?
No.
All right, are you feeling anything else out of the normal?
Discomfort from the C-collar?
Okay, discomfort from the C-collar. You guys, is that all they're good?
No, it's good.
Okay.
Oh, I was like, what?
All right, do you have any allergies?
Seasonal.
Seasonal allergies like hay or trees or pollen?
Yes.
Okay, any other allergies, maybe medications?
Yeah,
No.
we'll put this on.
Any, okay. Are there any medications you are taking?
No.
All right, do you have any medical history that's, we should probably know about?
I have a slow heart rate sometimes.
Slow heart rate, perfect. Okay, when was the last time you ate?
About an hour ago.
An hour ago? And you remember what happened? You said you were, what was going on?
I was hanging lights and I fell off my ladder.
Okay, were you all the way up at the roof line?
Yes,
How far did you, so you fell maybe 10 feet?
I think so.
Okay, alright. Well, they're getting vitals, I'm gonna go ahead and upgrade to ALS, just because of the height of the fall,
Okay.
and complain of lower back pain. We'll know more when she's in the vitals, he goes in the
Okay.
vitals. 10 feet's about a six fall.
Here.
It is, I think it's, for you guys, I think it's double the height of a patient, is it? You guys will have to double check that, but I don't think you're wrong based on mechanism, you'll get more into that, and also maybe because her breathing, even though
Yeah.
she's satting well, so that, if somebody's complaining of breathing, right, I mean, that's enough to consider or warrant.
Yeah,
a
I mean,
upgrade.
I guess she could have broken ribs, punctured
Yeah.
lungs, sort of thing.
Yep,
Okay.
No, fine.
so just enough reason, right?
Yeah.
Mechanism, she fell 10 feet from the ladder, she's complaining of being short of breath, you know,
Past
Yes,
200.
go to 200.
I don't think back pain necessarily warrants an ALS.
I'm just
well,
thinking
And you're gonna listen
the height
very well.
combined with the
With
pain.
pain, yeah,
So, but I guess the breathing is more permanent than the
Just turn it to
back
left.
pain.
yeah, so I think that's good, I like your thought process, you know, you started with being, okay, and this is kind of a grayish, it's not like she's bleeding out and can't breathe at all, that's obvious, right?
Sure.
This is sort of that in-betweener, but you just need to justify it.
I still can't hear you.
And
you're not gonna
when
hear it
when the
yet.
medics
You won't hear
show
it,
up,
so-
Is there any way of
Like,
screening
you hold it like this,
with
and your
medics,
fingers-
not just a call out?
no,
Cause we screen with fire, I'm police,
Uh-huh.
we screen fire all the time, like,
you
like
can,
this.
okay,
I don't
yeah,
know.
no,
Oh,
not in,
It's okay.
if you're gonna,
think
if
you
you're
just
thinking
need to
about
talk
calling
about
ALS at this point,
Okay.
as a BLS provider,
Then
you
just
just
do
call
it
them
now.
out, yeah.
Okay.
So you need to release a little bit faster.
There it is, right there.
And you're gonna have to, yeah, so in this situation, you're,